So today we have another one Q&A session to try to explain any question you have. All the questions are important, even if you feel it's simple question. Please put in the comments in the chat any question you have about the surgery. We know the new prospect bariatric patients have questions to know what happened before, after, during surgery here. So we are here to respond any question you have about the surgery and the preparation before, what expect after surgery, and what kind of surgeries maybe is the ideal for you. So we will start with Bobby. So the question is, do we have to have a drain tube? Depends of what type of bariatric procedure it will be your procedure. If it's gastric bypass, is for sure you will have a drain tube. And depends how much liquid and the consistent it will be. It depends how much time you will have the drain tube. If all is clear, the next day in the morning we will remove the drain without problem. If we see we have a little red drain, we maybe expect a little more in the afternoon we can remove. But the most of the patients will remove the drain the next day in the morning. For the gastric sleeve patients, I don't let a drain tube. Just in very special cases, if the patients have fragile tissue and we see any bleeding probably situation, maybe we can let a drain tube. But if not, with 99% of my patients, I don't let that drain tube in the sleeve. The sleeve no good. So the important with these sessions, the Q&A, is to clarify all the points, the doubts you have about the surgery. Any question you have, please put in the chat to try to respond and clarify any question you have. Okay. The drain tube is a little uncomfortable, but it's important in the gastric bypass the first 24 hours to check everything are good inside, and then we will remove the drain. We will be here for 30 minutes, so if you are thinking your questions, please put any question in the chat to see. We have, well, I am Dr. Valenzuela. I am a bariatric surgeon. I am in this company for 12 years. So any question you have, I try to respond. Hello, Marie. Says Marie, hi, I'm having surgery sleep with you on March 1st. I was wondering how many surgeries do you perform per day? My standard is three surgery per day. So I try to put all my attention in every patient and do the surgery slowly with attention and precaution for everyone. So I will wait for you, Mary. If you have any other question, please let me know. Okay, Brian. My surgery is in May. I am having the duodenal gastric surgery, is there anything you will recommend? Well, it's important you send a lab test to check your hemoglobin, and pre-op evaluation. It's important too. When you will have this kind of surgery, it's most important to check the hemoglobin and see if you are in a good levels in your lab test to get this surgery, because the surgery is a little more invasive. So you need to be sure all your levels are good. Hi Ronel Han says, hi Dr. B, you are doing my bypass on January 5. Any reason you will not go through with the surgery, e.g. scar tissue from endometriosis? Well, when we find scar tissue, very aggressive scar tissue in the cavity, it's very rare, but we need to change the procedure to sleeve surgery, but it's very rare. Sometimes from endometriosis on other previous surgery, we just clean all the scar tissue and we can go and continue with the surgery without problem. We can't know how strong and how heavy or difficult it will be the surgery until we go into the surgery. So we can't say 100% you will have the surgery, the gastric bypass, but in our experience, the most of the patients, 98% of the patients who have the surgery without problem. But in case you be into the 2% of the patients who can't do the safety surgery because the scar tissue are giving us problems, we can convert to sleeve surgery in that case. Okay, let me see the next. Okay, Georgina Kakuyu says, what happens if you have reflux before the surgery? Does it get worse? Depends. There's two types of acid reflux exist. One is because we are eating bad, heavy, and maybe a lot of spicy food, fatty food, and that could give us that acid reflux. And some other is functional because we have hiatal hernia, or just or sphincter is not strong enough to stop the food when we eat. In the case you are eating bad and you are eating a lot of spicy food, tobacco, alcohol, and fatty food, we resolve with the surgery that problem because we change your habits to healthy habits in your diet. But in the other case, if you have this malfunction of your sphincter, so we need to fix the sphincter, the hiatal hernia in case. But if it's bad, and you know you already have hiatal hernia, our recommendation for surgery is gastric bypass. Gastric bypass resolves the acid reflux. The gastric bypass is named like anti-reflux surgery. So in case you know you have hiatal hernia or bad acid reflux even when you are sleeping, so our recommendation is to get bypass and not sleep. Okay, next question says, Toby comes. tell Carla hi. Okay, tomorrow, because she is not here with me. Thank you. Kelly comes, she take care of me. Okay, good. I will let her know. Thank you for the regards. And Maria, hi Dr. B, I have an umbilical hernia. Is that okay? Yes, that is no problem. We don't go through the belly button for the surgery. Just if you choose seals, the single incision laparoscopic sleeve, we go into the belly button. But if not, we won't touch the umbilical hernia belly button area. Okay, Maria says, can you regainate your weight with a gastric sleeve? You can regainate your weight with any surgery, even with duodenal switch. We have patients here asking for revision from bypass, mini bypass, sleeve, duodenal switch, because they didn't get the diet. So we give with the surgery a tool, and you need to care that tool, following the rules in the diet, and try to eat and changing your habits, because if not, in the first year, first 12 months, maybe 18 months, you will lose all your overweight, and you will be happy. It's the honeymoon time, but if you don't change your habits in that time, you could regain weight after that time. So it's very important to change the habits, to eat healthy, and quit all the soda, chocolate, fatty food, processed foods, hypercaloric liquids like Starbucks, milk, and shakes, and all that kind of food, to help to the tool to reach your goal in your weight and maintain your long-term weight loss. Because if not, if you don't change your habits, you will regain weight, even with the bypass. Okay, let me check next. Okay, do you fix the hernia? Miranda says, do you fix the hernia if we have one? Once you get in there, yes. We will fix the hiatal hernia in case we found. It's important to explain that the hiatal hernia is born defect who is weak and open sphincter in between your chest and your abdominal cavity, and that permit the food coming through the esophagus to the upper part, and give you this burn sensation, the food, feeling the food in your esophagus, even in your mouth some cases, and we try to stop that acid reflux when we fix the hernia. We clean all the scar tissue around and put in the correct position again your esophagus. But the defect in the function in your sphincter, it's never again like in a normal patient. So for that reason, we recommend the gastric bypass in case you already know you have a hiatal hernia. If not, it's fine. We will repair in the surgery. So Stephanie Jefferson says, I have the sleep next week but have problems sleeping. Can I take melatonin or something? Yes, it's not a problem. We just recommend to stop the blood thinner medications When you are taking a lot of vitamins, we recommend to stop the birth control pills too, because all that give us blood thinner or blood clots. So we recommend to stop 1 week before surgery that kind of medication. But if you are taking pills to get normal pressure, for high pressure, for diabetes, and for any reason you are taking because you have an arrhythmia or something in your heart, we don't recommend to stop. You need to continue that medication. But the melatonin is not a problem. You can take it to help you to be maybe a little more relaxed. I know it's stressing to the travel and get the change. So Mary says, if I mostly gain my weight because of medications, will I gain it back after? Yeah, but I need to know what kind of medication are you talking about, because it is cortisone, that is a different problem, health problem. But please explain what medication are you taking. Okay, Miranda Nicole, you're doing my surgery in April. I'm so excited and ready. Okay, Miranda, so we will wait for you. Be sure you are follow all the rules to get the surgery, your diet, and stop aspirin, ibuprofen, naproxen, that kind of medications for all patients needs to stop before come 1 week before. Remember that medications cause blood thinners. It's like blood thinners, so we need to stop 1 week before surgery. Okay, the antidepressants need to continue. That is not medication to stop. Need to continue your antidepressant medications. And that medications, are you maybe asking about the previous question? Let me see. Mary, okay. That medication is not a problem after weight loss surgery, and it will be not giving us any problem to continue, and it's not medication who co-regulate weight with that. Okay. Okay. Shara says, do I need to stop sertraline before surgery? No. Sertraline is okay. Antidepressive and that kind of medications are good. Okay, Maria Tanner, how long do I need to wait after sleeve surgery before lifting weights? We recommend 6 weeks, complete 6 weeks with the healing process finished, and before that you can walk, you can do your normal life, but don't do heavy exercise or lifting any heavy things. But after 6 weeks you go run. Okay, Renelle says, also weight gain caused by menopause and heart. Will weight loss combat that? Yes. And all the improves with the surgery is because you will lose all this overweight and all your hormones will be in the normal levels, and this control hormonal, it will be okay. So remember, the obesity, the fatty tissue in your system, change a lot of things, and one of that things is the hormones. The hormones come back to the normal levels when you lose that weight. Okay, Jamie Denton. Can I get a revision from mini bypass to regular bypass? Yes, it's a common revision because we need to cut the bile way to put down and don't get any bile reflux. So some patients have that issues with mini bypass, the 50% of the patients. So in that case, it's good to get the complete bypass. I don't know what is your ask to want the revision, but the most common is the bile reflux or of course the reganate weight. So yes, we can do the revision to the complete bypass in that case. So okay, what is done? Maria says, what is done for pain control in the hospital and at home? We use anti-inflammatory medications and the painkillers. It's ketorolac. We don't use morphine, hydrocodone. That medications are not here in Mexico, and we know that medications give us more nausea, so you don't be worried about that because our medications are more tolerant with the patients, for the patients with less nausea and are less aggressive for the system. So we have a better results and better recovery time with our medications because are more kindly for the patients, okay? And we will continue the ketorolac oral way. Okay, Miranda says, do we have check-ins after surgery, after care? Yes, of course. Bobby says, I take thyroid meds and prescription hormones like estrogen and testosterone. I am also an inhaler for my asthma. When do I need to stop all of it? When you don't need to stop the thyroid, okay? The levothyroxine need to continue. The estrogens, that are the pro-clot medication, so that need to be stopped 1 week before surgery, and that's it. The asthma need to continue to the medication for asthma, okay? So just stop the estrogens. So Brunel, sorry. Ronette, thank you for taking the time to answer all questions, Dr. B. See you in 19 days. Okay, Ronette, I will see you here. Regards. Maria Tanner, how can I reduce nausea after bariatric surgery? Well, we will give to all the patients IV medications to stop nausea, strong IV medications, and reinforce in case. So the first day is the most uncomfortable day for nausea, but the next day it will be less, and as soon as you walk, as soon as you start with the oral way, actually we start the oral way the first day with ice, and the second day we start with liquid diet, so that reduces the nausea too because we are restarting the oral way, the intestine are working and moving, so that let us less nausea in the patient. So we will continue with medication when you have nausea, but it's our job. In the first 2 days you'll be in the hospital, we will continue that medication and start the oral way to reduce the most possible the nausea, okay? Okay, this is Maria Tanner, thank you. Regards, Mariam. Bobby, thank you. Okay, we are here maybe every 15 days, different doctors answering all the questions you have to help and be a little more clarify your way to the bariatric surgery. So, Maria Tanner, it is true that the stomach grows in gastric bypass if food not controlled. The stomach can't grow, but could stretch a little bit. So if you put, it's like a muscle. If you put the muscle to do a big effort, it will be more big. If you reduce that effort, it will be a little more tiny. It's the same in the stomach. We have a stretch in the stomach. If you put more and more food, you will have a stretching stomach, bypass or sleep. If you put the correct count of food, you won't have that stretched stomach. So the rules are important. We have rules to eat. We need to stop the liquids 30 minutes before and after and just eat the portions we know we are tolerating good and enough with not nausea sensation or with this pain, gas pain. We will know when we start to eat how much is our comfortable measure. So we need to start with protein in the first time. The protein needs to be the first portion you eat, because that it will give you the good calories, the protein and not false calories. And next it will be the carbs and salads. But if you eat in that way, not mix the liquid and the solid food, you will conserve your stomach in the normal size and don't stretching the stomach at the end. And need to eat slowly and chow every bit many times and see if you are full or not. If not, you can try the next bit. And slowly to know and learn when you need to stop. Okay? Okay, Maria, are you celebrating Christmas? Yes, we will celebrating Christmas the last week here, 22 to January 2. We will be, well, my group, it will be out to celebrate Christmas. So I think we answered all the questions. I hope to see you the next year or the next week, maybe. Some says January, others May, but maybe all these questions for the next year. So if you have any other questions, maybe we will do another Q&A in the next month. Take care, have a Merry Christmas and Happy Holidays.